When you think about businesses that are selling through the roof, like Skims or Allbirds, sure, you think about a great product, a cool brand, and great marketing. But an often overlooked secret is actually the businesses behind the business, making selling and for shoppers buying simple. For millions of businesses, that business is Shopify. It's home of Shop Pay, the #1 checkout in the world. You can use it to boost conversions up to 50%, meaning way less carts going abandoned and way more sales going through to checkout. Upgrade your business and get the same checkout Allbirds uses. Sign up for your $1 per month trial period at shopify.com/income, all lowercase. Go to shopify.com/income to upgrade your selling today. Shopify.com/income.
Hi everyone, I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening. Hi, I'm Deb Flashenberg, and I'm your host of Yoga Birth Babies, and we're starting a new series. We'll be releasing about once a month, once every 6 weeks, podcasts from the past. I'm calling it Podcasts from Our Vault. People have reached out about certain podcasts over and over, saying how much they enjoyed them and which were really popular. So the first one I want to bring back was Sex During Pregnancy and After Baby with Dr. Sabrina Baxter. This was the most popular. We got the most feedback from people, and people learned from it, found confidence in it. So let me tell you a little bit about what you'll hear in this podcast. So some of the things were concerns that sex during pregnancy will hurt baby, and reasons that your vagina might feel different when you're pregnant. And then when maybe it's a good idea to abstain from sex when pregnant, and should sex hurt? And some of the most common reasons that sex may hurt. So we dive into this. So let me tell you a little bit about my guest, Dr. Sabrina Baxter. She is a doctor of physical therapy specializing in pelvic floor dysfunction for all genders, ages, and walks of life. She's very passionate about spreading education and awareness of bladder, bowel, and sexual health to help people prevent dysfunction, but also to help those with dysfunction acquire a proper diagnosis from their doctors to receive appropriate individual treatments. This podcast I found amazing. I loved bringing this topic to the forefront because some people can feel shy about it. And let's answer questions that you may have. When I originally was preparing to interview Dr. Baxter, I gathered a couple of classes of students and asked them what they wanted to hear. So the questions I asked were gathered directly from our community. So from one community to the other, I hope you enjoy this conversation with Dr. Baxter. Before we get to that conversation, I always love to give an update about what's happening at the studio. Things are going great. It's really exciting. So always check out our website for our online and in-studio class schedule. We have classes online every day, in studio 6 days a week. Our workshops are doing amazingly well. In fact, they're selling out. So grab your spot. If you're putting it off, grab your spot because it may sell out. And of course, for those that can't make it in studio, we have everything online on demand. So it fits your schedule. And maybe you're listening not as someone that's pregnant or expectant, but as a yoga teacher that's interested in the perinatal work. I got you covered for that. Check out our teacher training, our Prenatal Yoga Center teacher training. It is a very in-depth training that is covered over a 3-month span. We do it in person, we do it online, and of course we have our postnatal teacher training. So all that information is on our website, prenatalyogacenter.com. And then the last thing I want to say is just a big thank you. I want to say thank you for all that you have given us as a community, for your listenership, as well as for those that have listened and have provided ideas of content. I love getting an email from someone saying, "Oh, I had this idea. This would be a great guest," or "Have you covered this topic?" So if you have an idea, if you are a speaker, send it my way. I love expanding what we offer. All right, I think that's it. Please enjoy this very popular podcast from our vault. We'll take one more quick break and we come back. Please enjoy my conversation with Dr. Sabrina Baxter.
We have one more act for you this evening. I don't even need to say his name. Mr. Bob Dylan.
From the director of Walk the Line and Ford vs. Ferrari.
If anyone is going to hold your attention on stage, you have to kind of be a freak.
And starring Timothée Chalamet as Bob Dylan.
Are you a freak?
Hope so.
Once upon a time, you're just so fine.
Inspired by the true story.
I want to know which side he's on.
This Christmas.
They just want me singing Blowing in the Wind for the rest of my life.
Bobby, what do you want to be?
Whatever it is they don't want me to be.
He defied everyone.
Turn it down!
Play it loud!
To change everything.
He's our Elvis.
With no direction.
Timothée Chalamet, Edward Norton, Elle Fanning, Monica Barbaro.
Make some noise, BD. Track some mud on the carpet.
A complete unknown. Only in theaters Christmas Day. Rated R. Under 17 and admitted without parent.
Hi, Sabrina. How are you?
I'm good. How are you?
I'm doing great. I am really excited to have you on my podcast and have this conversation. I have to tell you, so many times after class, people are in little groups talking, and I definitely hear them talking about sex during pregnancy and then what it's going to be like after baby. So I think many people are going to appreciate this. So thank you for coming on.
Of course.
So let's get started with just learning a little bit about you and how did you come to focus on pelvic floor physical therapy?
So I kind of was thrown into it. I was in my doctorate program, and probably into the end of my second year was when we had a lecturer come in talking about pelvic health, specifically about pregnancy postpartum. Actually, I hadn't heard anything about pelvic health prior to, and just her talking about the different changes during the body and things that can happen after pregnancy postpartum. I was like, oh, that is definitely something that I would love to empower women on. I've always been the kind of friend that was very open when it came to sex, discharge, infections, like whatever it is. I was the friend that would talk openly about it and be like the least judgmental. I love talking about this stuff. So when that lecturer came in, I was like, I could definitely see myself in this field. And I requested a clinical rotation in pelvic health. And that was when actually I was exposed to all different ages, both men and women, all different diagnoses and conditions, not just pregnancy postpartum. Actually, pregnancy postpartum were probably like less than a fourth of the patients that I saw, which was crazy, which we'll get into that later because I think that it should actually be like 50%. But I was like, wow, there is so much to pelvic floor dysfunction and so few people know about it and know about pelvic floor therapy as a profession. And just like thinking about things that I had gone through, like whether it was chronic infections or having pain with sex myself, and just being like, oh wow, these were all things that I should have known about, or I could have known about, or I could have kind of learned how to find treatment for. It was just really cool. And that's when I started my social media, and I was like, I have to tell the world about this.
I think it's so great because I think so many people live with pain, and we're going to talk about that, pelvic floor and fear around pain and fear about the pelvic floor and fear about pregnancy and sex. And they just don't know who to talk about or feel that they can't. So right. I love that you put it out there because I think the more we create this as a conversation, the less of a stigma, and then people can live a happier life. I think if they're not scared of their bodies.
Yeah, that's the goal. I mean, everyone deserves the best quality of life possible. And it shouldn't be normalized that being pregnant and being postpartum should just come with pain. I feel like that's so normalized, but just because something is common doesn't make it normal.
Absolutely. I mean, that's a whole nother talk about incontinence. Just because you pee yourself doesn't mean you should be. Right. So let's shift this to sex during pregnancy. So I actually sat down with some of my students and I told them I was having this conversation. So I let them feed me some of the questions because I wanted to make sure that it wasn't just coming from my brain, but from what the community wanted to know. And one of my students was concerned about sex hurting the baby. And I said, I really don't think it does, but let me throw that out there. I said, they're well protected. Your cervix is long. They're in the amniotic sac, but let's get an expert advice. So for the student that's saying, can sex hurt the baby? What do you have to say about that?
Yeah, sex cannot hurt the baby. Listen, unless your medical provider or your physician or your gynecologist, whoever you're working with, if they say, for this medical reason, you should be avoiding having sex, I would not worry about sex hurting the baby. Honestly, worry about you, worry about your orgasm and get those endorphins in. Sex is great when you're pregnant. It's very, very necessary. I think it's great just to kind of relieve your body from all the tension and the stress and just even calm your mind. But yeah, the amniotic sac and the strong muscles of the uterus protect the baby. There's a thick mucus plug that seals the cervix and helps guard against, really anything, including infection. So, and during intercourse, the penis can't even really go beyond the vagina. So it's definitely not going to reach or penetrate the baby. So sex is not dangerous while pregnant.
Yes. All right. Let's check that one off. All right. Another question was, what are some reasons that someone might say that their vagina feels different when they're pregnant?
So your vagina, also this depends on the trimester that you're in. But the more pregnant you become, the more blood flow, like pregnant women have an increase of 30 to 50% of blood volume. So the more blood flow that you get to your pelvic organs, the more pressure you may feel, the more relaxed you may feel, things may feel quote unquote looser. I'm not the biggest fan of that word, but just, things may just feel a little bit more relaxed in that area, which is why, someone may say their vagina feels different. Also on top of that too, you may have just some increased pressure in that area because of where the baby is hanging out. Some people say that when you have a boy, the boys hang really, really low, whereas girls don't hang as low, but really wherever the baby is sitting, that can provide, put some pressure on your pelvic organs and just feel a little funny in that area.
I actually should have pressed the student to be like, well, what do you mean by different? But I was fascinated. I'm like, oh, that's really interesting. So another question that came up is there any time, and this may be beyond your scope, but I'm just going to throw it out there. Is there any time someone should abstain from sex when pregnant?
So yeah, this is just super individualized and this would be up to their doctor's discretion. I would, as a pelvic floor physical therapist, I would tell someone to avoid sex if one, it was uncomfortable for them, if they were having morning sickness or they were feeling fatigued or tired or low energy. I would, and that really goes for anyone. I would never say, push yourself to have sex if you're not in the mood to have sex or if you're not enjoying sex. But medically speaking, depending on if they had a certain diagnosis attached to them or their doctor was monitoring them, like whether it was their blood sugars, their blood pressure, whatever it may be, that would be more up to the medical doctor's discretion and that would be out of my scope. But just from a pelvic floor therapist perspective, if everything looks good on my end, I would just say, hey, if you're not in the mood, then don't do it. That's really it.
I've had some people tell me that their care providers, if they had placenta previa or cerclage, that they were on pelvic rest. But again, that is very individualized. So I'm glad that you brought that up. Like there's no broad stroke. Exactly.
Like preeclampsia, some cases of gestational diabetes. It really depends on what's happening physiologically. And that isn't something that I would monitor. I would be informed as part of the team, but I wouldn't monitor that.
All right. So here's a big one. What can someone do if sex hurts because we don't want it to hurt?
Yeah. So this is my favorite topic.
Okay, go.
One important thing, and this has been a little tweak that I've actually told a lot of my pregnant patients and postpartum patients, is just focusing on your breath. And I know, you being in the yogi space, breath is a huge thing. Deep, slow, diaphragmatic breaths really, really help in relaxing the pelvic floor muscles. Like when you take big diaphragmatic breaths, every inhale provides some pressure downwards onto the pelvic floor and helps those muscles relax. And on top of that too, it helps you tap into your parasympathetic nervous system, just all around putting you in this nice, quote unquote rest and digest state. So really, really focusing on your breath if it's painful. Obviously, I feel like this goes without said, but lots of, maybe it doesn't, lots of foreplay, really warming yourself up. Even though you have increased blood volume, that doesn't mean you got to skip the foreplay. Definitely warm yourself up. And remember too that if sex is super, super painful, or you don't have to be having penis and vagina sex. There's lots of different ways to have sex, and oral sex can be a good starting point. Using lubricant, both internally and externally. Do not use, well, I guess it doesn't matter. I was going to say don't use oil with condoms, but if you're pregnant, it doesn't matter. But yeah, using lots of lubricant, make sure things are nice and wet, and trying different positions. I usually find, or just from like feedback from my patients and just from feedback from my own experience with painful intercourse, is the positions that I have more control over are the ones that, you know, I feel less pain, like where I can navigate the depth, I can navigate the speed. That's usually easier. Sometimes that can be missionary, depending on how big you are with pregnancy. That may be a little uncomfortable. Side lying can be comfortable. So yeah, really just finding positions that work for you. And I think this is really important to say, but I feel like a lot of women feel like they have to kind of like perform with sex, or they have to like, you know, you don't have to be doing 1,000,001 positions. Like you can find a position that feels really good for you and works for you and just be like, hey buddy, like this is the one we're doing and we're sticking to this one. So, you know, find what works for you and just stick to that. Because obviously what's the most important is that you're also enjoying this.
So what are some reasons that sex would hurt? I feel like the obvious is tightness in the pelvic floor, but how would someone deal with that, and what are other reasons?
Is this for pregnancy? Well, while you're pregnant?
Ooh, let's actually break that up. Let's do prenatal and postnatal. So thank you. Let's do why it would hurt prenatally and then why it might hurt postpartum.
So prenatally, it could be, you know, like you said, there's an increased amount of pressure, or just how big the baby is growing. So that kind of pressure can be super uncomfortable. And that can be one reason why sex is uncomfortable or painful, during pregnancy. Other ones during pregnancy, I mean, if you're already were having pain with sex prior, and let's say you're in the first trimester, second trimester, and, you know, you're really not getting that huge increase in blood volume or that huge like relaxation of your pelvic floor muscles, you could still have some lingering pain with sex. But I would say probably the biggest one that I see is just the pressure and the new sensation that they're feeling.
How often do you think, and then I'll ask about the postnatal, but how often do you think a pregnant person's pelvic floor is on the tighter side?
Honestly, a lot more often than you'd think.
Mm-hmm.
While yes, the increase in blood volume can help kind of relax the pelvic floor, this doesn't mean it is like a 180, you know? So that's actually one reason why people are at risk of tearing with pregnancies, because they have a tight pelvic floor. So it's super important to get checked out like during pregnancy, before even when you have an idea of getting pregnant, just to, you know, play on the safe side, get checked out by a pelvic floor therapist just to kind of see what your baseline is at, because a lot of women have tight pelvic floors and don't even know.
Yeah, I actually find that in class. We're constantly, when we do the pelvic floor work in class, I go through a list of indicators, and I have people, I can see it on their face like, oh, I fit into that. And I'll remind them, like, just because you think you should tone your pelvic floor, if you hit any of those indicators, don't do it, resist doing it. And I've had students say, but I feel like I should. I feel like that's what I'm supposed to do. And I feel like it's a big misconception of, oh, I'm pregnant, I better engage. Actually, I think it's more common postpartum. A baby just came out, keep squeezing, and then they're making themselves tighter. Would you agree?
Yeah. I mean, when I work with patients that are pregnant, let's say they're in the third trimester or postpartum, well, not immediately postpartum, but, you know, and when they're getting back to their baseline, I'll just do whatever's functional for the patient. So like, I'm never the practitioner that's going to say, oh yeah, you need to be doing like 100 Kegels a day. No, I usually like to do a combination of the two. Like if I have someone that has a tighter pelvic floor, but they could also be working on strengthening, I'm going to say, listen, your stretches, your pelvic floor stretches, your, you know, perineal massages, whatever, you know, diaphragmatic breathing, whatever we need to do to kind of down train your pelvic floor muscles, then follow it up with up training. So that's when we do, you know, adding Kegels in with diaphragmatic breathing, or doing transitioning into lifting with Kegels, or, you know, pelvic tilts with Kegels, just more functional strengthening. But I would never really tell someone, you need to be, too many doctors say that. They're just like, okay, postpartum, start Kegling and don't stop.
That's basically, I remember I had 2 kids, and I would do my 6-week checkup, and they would insert their fingers, okay, engage, like, okay, just go do your Kegels now. And that was it. That was like,
Right.
And there you go. And fortunately I had some background to this, so I knew there was more to it, but a lot of people don't. And then they think they're following directions and they can be causing. So let's lead that into what are some of the common reasons postpartum that sex may hurt?
So there's going to be probably a lot more postpartum. Postpartum can be, and this goes whether you have a vaginal delivery or a C-section delivery. So let's split this up now to C-section. So if you have a C-section delivery, that is a major abdominal surgery. And so many people just kind of brush that under the rug. But what kind of surgery have you seen that isn't followed, like massive surgery like that isn't followed up with physical therapy? Zero. Like you have surgery on your knee, which is probably the scar is the size of like maybe half my finger. You get physical therapy. People that have C-sections are very rarely followed up with pelvic floor therapy, physical therapy. And like I said, you're literally cutting through like 8 layers of tissue. So with C-section, when you're cutting through so much tissue, you can have scar tissue never forms as elastic as the original tissue. So you can have tissue restriction. You can have myofascial restriction. This restriction can also impinge on a nerve. So I've literally, not to scare anyone, I mean, these are just things that can happen, but I worked with a patient who she actually had a tummy tuck and she had a C-section surgery, and she started experiencing clitoral pain, which was a result of a nerve all the way up in her abdomen, which was affecting her pudendal nerve, which was affecting the blood supply and nerve supply to the clitoris. So it's just crazy how, our whole body is connected. And when we have these huge scars and this tissue restriction, it can affect the muscles and the nerves in that area.
Was it pain all the time?
Yeah.
Oh, I feel for her.
Well, it's not uncommon, but it just goes to show that it's just such a big surgery and there's so much tissue involved that you really have to get in and mobilize the tissue. And not a pelvic floor therapist doesn't necessarily need to do that, because I know not everyone has access to a pelvic floor therapist, but there's a lot of different ways you can mobilize scar tissue. There's a lot of ways on YouTube, on Google, but it's really just the key thing behind the C-section is mobilizing that tissue. And on top of that too, just because you have a C-section doesn't mean your pelvic floor didn't take any of, didn't do any work. Like you were still carrying a baby and it was putting a lot of pressure down there. So people can experience things like incontinence, pain with sex, et cetera, just from being pregnant.
So that was if it hurts for cesarean, that might happen. What about for a vaginal birth, especially if they had tearing or it was a traumatic birth?
Yeah. So with vaginal birth, if you experience any kind of tearing, that can same kind of thing with tearing. There needs to be a healing of that tissue, and scar tissue is what's going to heal that tissue and put that tear together. So again, scar tissue is never as elastic as the original tissue. And that's when we would do some like kind of internal work to kind of massage the tissue, perineal massage kind of work to just mobilize that tissue, mobilize that area to allow for easier penetration. But, and also just, moving off from vaginal delivery for both C-section and vaginal delivery, just pregnancy in general, postpartum in general, you have this change in hormones, right? So when you have these hormonal changes and you have this decrease in hormones, you can start experiencing like vaginal dryness, you can experience decreased libido, and all of that can contribute also to pain with sex.
All right, I want to stick with that. We're going to take a quick break. When we come back, let's talk about what we just talked about, the hormones and how they can change postpartum. Let's talk about what we can do when these things do come up, the vaginal dryness, the low libido. So we're going to take a quick break. When we come back, we will answer those questions. We'll be right back.
Is your cold making it hard for you to get to sleep and leading to a bad morning? Switch to Mucinex Night Shift for fast, powerful nighttime multi-symptom cold and flu relief. Mucinex Night Shift fights your worst nighttime symptoms to help you get to sleep and wake up ready to go. Mucinex Night Shift. It's comeback season. Use as directed.
What's up, y'all? It's Joe Budden, here to talk about Prize Picks. Football season is heating up, and Prize Picks is the best place to get real money sports action while watching football. With over 10 million members and billions of dollars in awarded winnings, Prize Picks has made daily fantasy sports accessible to all. The app is really simple to use. Pick 2 or more players across any sport, pick more or less on their projection, and you could win real cash on your lineup. Prize Picks even invented the Flex Play, so you can still cash out if one of your picks doesn't hit. On Prize Picks, you can mix and match players from different sports, Real money sports action while watching football.
Download the PrizePicks Daily Fantasy app today and use code FIELD and get $50 instantly when you play $5. That's code FIELD on PrizePicks to get $50 instantly when you play $5. You don't even need to win to receive the $50 bonus. It's guaranteed. PrizePicks. Run your game. Must be present in certain states. Visit prizepicks.com for restrictions and details.
All right, so we're back, and I bet you just grabbed the attention of many listeners that are postpartum or are heading into that. So let's dive a little bit deeper. Postpartum hormones, there is a massive drop, especially if someone continues to breastfeed. So you mentioned vaginal dryness, low libido. What else could be an effect from postpartum hormonal change, and what can someone do to combat that?
So postpartum, there are pretty low estrogen levels, which pretty much stay low until a woman starts cycling again. And this can last throughout the duration of breastfeeding too, but this can contribute to hot flashes, different kinds of pelvic floor dysfunction, vaginal dryness, low libido, hair loss. Those are all pretty common symptoms that can happen, especially between 1 to 5 months postpartum. And on top of that too, with breastfeeding, you still have an ongoing production of the hormone relaxin. And this hormone is essentially really helpful to help soften the joints and the ligaments in order to make space for the growing baby. But postpartum, this can contribute to joint laxity and just overall cause some discomfort and possibly pelvic pain too. And also the hormone relaxin can also contribute to some aches and pains. Like I said, it helps loosen the ligaments to help you move closer to childbirth. But just the how relaxed you get during that can really cause some pressure on your pelvic organs and kind of contribute to that pelvic pressure, which also can contribute to some pain with sex.
So I want to back up because I remember when I was asking my students, I asked the postpartum students as well, and a couple of them did have pretty traumatic births. And the idea of sex actually scared them because their pelvic floor just felt so foreign and disconnected. Yeah. What would you say to the person that had that traumatic birth and wants to kind of get back to sex, but there's just a lot of fear around that again?
Definitely be patient with yourself and be really kind to yourself because you did go through, birth trauma is very, very real, and whatever the birth trauma is, it's still your experience, and no one should ever invalidate how you feel, how you felt giving birth, and how you feel after giving birth. And I really, really recommend, because postpartum depression is so real and so prevalent and so many times goes often undiagnosed, and I really recommend working with a therapist, whether it's cognitive behavioral therapy or a talk therapist, just because getting that support is so crucial. And it's really hard sometimes to talk to your husband or to talk to your partner, to talk to a family member because they don't really get it, So it's really, or to even join support groups. Like, it's really, really helpful to talk to someone who's been through something that you've been through. Number 2 is definitely work with a pelvic floor therapist. Pelvic floor therapists, especially ones that work with pregnancy and postpartum patients, see this a lot. It's very, very common. So working with someone that has the knowledge and the tools to kind of tell you, all right, this is how we're going to get your body back to the way it was. This is, let's make a checkbox, right? Like, let's make a list. What do you have to get through what kind of things do you want to check off until you feel good in your skin and you feel good in the bedroom and you're mentally and emotionally and physically ready to have sex? So it can be really helpful to work with a specialist like that, pelvic floor specialist, because we know what criteria your body needs to meet before you're going to have pain-free sex, So we really want to make sure that the stars align and you're feeling good mentally and emotionally, and then your body's feeling good physically.
What are some of those criteria that you're thinking about for this person that had trauma before that and then wants to have sex?
From a physical standpoint, how are your pelvic bones feeling? Like, do you feel an alignment? Do you have pubic symphysis dysfunction? Do you pelvic pain? Do you have hip pain, low back pain? Like, where are you feeling joint and pain wise and bone wise? 2, how are your pelvic floor muscles looking? I think that too many providers tell postpartum moms to go back to sex 6 weeks postpartum, and they're just like, what? Absolutely not. And that's okay. Just because that's the standard doesn't mean that's your standard. That's most of my moms don't want to go back to sex 6 weeks, and that's totally fine. There's nothing wrong with you if that's the case for you.
Do you have any idea where did that standard come from? I'm just curious. I've been hearing this for 20 years, and I've just accepted it. And then all of a sudden it popped in my head. I'm like, who set that standard? Is it because that's typically when the loci of the bleeding stops? Like, I'm just wondering where that 6 weeks came from.
I mean, I'm not 100% sure, but just from what I know is that it takes tissue 6 weeks to heal. I mean, obviously it depends on the severity of the tissue, but most tissue, most cuts, these things typically take 6 weeks to heal. So that's probably why they're like, oh, around 6 weeks, like you're
okay.
Good. Oh, but that's very rarely the case. I mean, I have had some moms that they're like, yeah, I'm good. Like, I'm ready. I went back to sex on it. But I would say probably 85-90% of my moms are like, there's no way my husband's touching me.
All right. That makes a lot of sense. All right. So I start to think about, so not only that's my students, I sat down and started to think about the pelvic floor and sex. And okay, I'm going out on a limb, so tell me if I'm wrong. But when someone orgasms and the pelvic floor muscles contract, is that helping them tone the pelvic floor? Like, is that like a little exercise jolt for the pelvic floor?
Okay, so if you want to believe that, sure.
No, I don't. I have no idea. That's why I'm asking. It's just thinking about.
But I mean, that's why you want to have, if you want to just keep telling your partner, we have to have sex because it's increasing my pelvic floor strength, go for it. But, no, having, experience, yes, you're contracting your pelvic floor. You're absolutely right about that. But, that one time isn't necessarily working it out. You know what I mean? Like when we do a workout, I'm not just doing one bicep curl and I'm like, yeah, I just worked out my bicep. So, no, but yes, it's contracting the pelvic floor. So, I mean, it's a good way to know how to contract the pelvic floor.
So I'm just thinking is that something someone can think about in preparation for birth or kind of on the recovery, or is it just, it's enjoyable for hopefully most people and the muscles just getting a little release and stretch?
It's I mean, it doesn't really prepare you for childbirth, because with childbirth, you don't want to activate your pelvic floor. You want to relax your pelvic floor.
Right. I guess I was thinking there's a contract and release. So it's teaching people how to relax.
Oh yeah. Yeah. I mean, sure. Yeah, I guess. I mean, having an orgasm is great. Pelvic floor muscle contraction is great. It's, when I say don't do Kegels, it's not don't ever do Kegels. Your body will naturally do Kegels. Sometimes people, they finish peeing on the toilet and they just do a little squeeze and they're like, oh, I'm all done. People just will randomly do pelvic floor contractions during the day. Kegels obviously are overprescribed, but they're also, I think they have a bad rep too, because they are obviously essential for a lot of reasons and they are very helpful. And just your body's natural response, most people, they naturally just Kegel when they have sex because it brings more just emphasis to the orgasm, and that's totally safe and great, but it's not necessarily a workout.
All right. I was just trying to think of how we can work. If people enjoy sex, how we can be yeah, and I'm doing something extra for preparing for birth. I was just trying to think outside the box there. All right. All right. So another thing that came up in class, because, oh my gosh, I love this one student. I won't say her name, but she was telling me how for about 3 or 4 weeks after she had her baby, she would look at her vagina with a mirror. And I thought, that's great. You get to know your body. And she said she saw some great changes in there. And I said, I'm sure you did. So how does someone's vagina change after birth? And when does it, and I don't want to put necessarily get back to normal, because as my midwife said, the landscape of your pelvis is forever changed. So knowing that the vagina is changed, when can we expect it to regain some semblance of what it used to look like, and how has it changed after birth?
Yeah, so this is a good question, and your body changes a lot with pregnancy and postpartum, and with birth, if you have a vaginal delivery, or even if you don't have a vaginal delivery, there's a lot of pressure going down your pelvic floor, and with a vaginal delivery too, you are literally stretching to get sometimes even a 10-pound baby outside. So sometimes people can have a little bit more opening. You can just kind of see more of an opening. Sometimes people can see a little bit of a protrusion of tissue, just not that there's like a prolapse, but there's just a little bit more laxity to the tissue. Sometimes there is a prolapse, and just from the opening, I can see kind of a bladder prolapse or a rectal prolapse, and we work on that in therapy. But, I really like first of all, I tell people not to look and get freaked out 2 to 3 weeks postpartum, because again, you're still in the whole healing phase. Like, things are going to change. They're not going to look the way they look 3 days at postpartum. You know what I mean? Like, don't freak out. And I actually have a patient that I saw the other day, and she's 3 weeks postpartum, and she's like, oh my gosh, I can see a protrusion of tissue. I'm like, just wait. Like, your body is still healing after giving birth. So let's just wait until I see you, and yada, yada, yada. But really, from a pelvic floor therapist perspective and standpoint, I am going off of how you feel. Like, the last thing for me is like how you look there, like how I want to make sure you feel good. Like, you feel good in your body. You feel like your pelvic bones and muscles are supported. You feel, quote unquote, tighter in the sense that you just feel like everything is where it's supposed to be, like it's the same kind of thing goes for how we feel about our bodies, in general, like look wise, tone wise, like how you feel says so much more than how you look. Right. Yeah. And that's really what people should be chasing at, is how do I feel, energetically today? How do I feel just like in general? How are my fatigue levels? How's my energy? How's my outlook on life? Like, there's so many more things that are more important than how you look. And that's for also postpartum and how your vagina looks.
That's a great answer. All right, so this question popped into my head because last weekend in postnatal teacher training, somebody asked why I don't tend to do a 3-legged dog. So down dog, your hands are down, your butt is up, your feet are down. Yeah. And in a lot of vinyasa classes, people will lift the back leg to swing it forward. And I have been teaching this for years, and I have noticed that if I do lift the back leg, a lot of people get what I call an airy vagina or queefing. So is that due to the muscles have been stretched out? Is that due to the laxity because of relaxin? Why are my postpartum folks getting airy vaginas?
Yeah, that's a good question. So actually, some yoga poses that can be super helpful for being bloated or being constipated are down dog, child's pose, because you are kind of putting pressure on your abdomen and your pelvic floor, and you're really opening up those pelvic floor muscles. So you're kind of stretching those muscles in that position anyways. So if you already have a little bit of laxity from postpartum, let's say your vaginal tone isn't what it needs to be. And this really goes for if you have like chronic queefing, because that's queefing, right? So like if you're always queefing, then, definitely work with a pelvic floor therapist to work on that tone and see where your pelvic floor muscles are at. But if it's like a queef here and there, not a big deal. But yeah, to your point, like it's usually because there's some laxity and some air is getting trapped and it's just releasing.
Yeah, that's was literally the answer. I told them, like, I don't lift the back leg because of the airy vagina queefing. But that's a great point that if someone's, and I didn't think about that, if they're getting it all the time, they should look into that a little bit more. Well, I feel like you answered so many questions. And I know this is something you're really passionate about. Is there anything else about sex during pregnancy or after baby that I didn't ask about that you think is really important to share?
I think we covered a lot during pregnancy. I think that my biggest thing would be, again, sex during pregnancy, you're not hurting the baby, and have sex if you feel like you want to have sex, and remember too, there's a lot of different ways that you can have sex. It doesn't have to be penetrative sex at all. Postpartum wise, definitely if you're, also just during pregnancy in general, if you're in pain, go see a pelvic floor therapist. You don't have to wait till you're postpartum. You don't have to wait till 6 weeks postpartum. Like, right now, if you're pregnant and you're in pain and you're uncomfortable, go see a pelvic floor therapist. I can't even tell you how many pregnant women I've worked with, and they're like, I have been suffering. I've gotten corticosteroid shots. Like, finally my doctor prescribed me pelvic floor therapy, or finally I found information online and just just went with it and saw you. And 2 sessions later, they're not in pain anymore. Like, it's just crazy how much just some deep tissue pressure can do to the body, and some pelvic mobilizations and bone mobilizations can do to help the body feel less pain.
And I bet that really changed the quality of their life. All right. We're going to take one final break. And when we come back, if you have one final tip or piece of advice you'd like to offer new or expectant parents, and it can be anything. It could be pelvic floor. It could be sex. It could be anything that pops into your mind that you want to leave people with. We'll be right back. So what would you like your parting words to be?
My parting words, I think this is going to be for my postpartum moms. I definitely want you to know what to expect. So I really think that when moms are informed, they're more equipped to handle the normal physiologic and emotional shifts postpartum. I really want you to be selfish and focus as much on your self-care as you can. I really think that the medical field puts a lot of focus on the baby and not enough on the mom. So definitely make sure you're able to. Obviously, you're going to be tired. It's going to be a whirlwind of emotions, but do as much as you can for you. Sleep as much as you can. Eat plenty of food, lean on your support system. Don't cut calories, eat. Make sure you're eating because your body just literally ran a marathon and has no time to recover. So make sure you're eating and, just practice patience and be really patient with yourself and, don't try to rush the postpartum process. I love the quote that says, you just built a baby for 9 months. You literally just carried a human for 9 months. Do not expect your body to just bounce back in less than 3 months.
How annoying is that quote, bounce back? Oh, you totally nailed that.
I hate that quote. Bounce back. No one can bounce back. You're literally one doctor, I forgot her name, but she had a great analogy. She's like, people run a marathon and they get to recover for 3 days. You give birth, you don't get to recover at all. So it's how do you bounce back from that?
Yeah, it is. It is a lot. So where can people find your work?
So I am located in Fort Lauderdale. So I see clients in person in Fort Lauderdale, Florida. I offer virtual consults. My website is drsabrinabexter.com.
The most wonderful time of the year. Although, let's be honest, around the holidays, things really add up. But here's the good news. Only at Verizon, you can get a single line for $50 per month when you switch and bring your phone. So while ice skating for two is definitely costing more, here at Verizon, you can save. Gifts for your third cousins? Steep. A single line with Verizon? Not so steep. A real tree? Pricey. A single line with Verizon? Less pricey. Flights to see Mima and Pops? Those are up. A $50 per month single line? That's down. Even a trip to the Atlanta Holiday Market will cost you more. But with Verizon, you can switch and bring your phone for just $50 per month for a single line on unlimited welcome with autopay plus taxes and fees. All this to say, during the holiday season, when everything is costing more, you can get more for less right now at a local Verizon store. $15 monthly promo credits applied over 36 months with a new line on unlimited welcome. In times of congestion, unlimited 5G, 4G LTE may be temporarily slower than other traffic. Domestic data roaming at 2G speeds. Additional terms apply.
You can find me on Instagram at dr.sabrinabaxter and TikTok at no such thing as TMI.
Oh, perfect. I will make sure all of that is on our show notes. Well, thank you so much. I really enjoyed this. You answered the questions I gathered, and I feel that people hopefully will feel really empowered to enjoy sex and not be scared of it. So thank you for your time.
You're so welcome. It was so much fun.
This has been an episode of Yoga Birth Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.
You've decided to give your baby breast milk. We want to help. We're the Boob Group, a group of moms and experts here to support you in your goals, whether you're breastfeeding, pumping, or something in between. Each week, a group of experienced moms openly discuss their success, their struggles, and society's impact on how they feed their babies. We provide an honest, natural, and judgment-free approach to breastfeeding, pumping, milk sharing, and more. Subscribe through your favorite podcast app or say, "Hey Alexa, play the Boob Group podcast." The Boob Group, where moms know breast.